Hello and welcome to the program. I'm your host, Neal Howard. Thank you for joining us here on Health Professional Radio. In this segment, returning guest, Dr. Kurt Newman, is President and CEO of Children's National Health System and also the author of Healing Children, a Surgeon's Stories from the Frontiers of Pediatric Medicine. He's returning to speak with us about how a pediatrician's knowledge of the strategies and personnel of a hospital can be fundamental, even life-saving when it comes to an emergency situation with your child. Welcome back to Health Professional Radio, Dr. Newman. Glad that you could return.
Well, it's great to be back here with you, Neal.
Now, for those who aren't familiar with you when you were here with us before, give us just a little bit of brief background about yourself and talk about why you wrote Healing Children.
Sure. Well, most of my career, I was a practicing pediatric surgeon here at the Children's Hospital in Washington, D.C., and then 6 years ago had this incredible opportunity to become the CEO of Children's National. And I wanted to, in that role, put into practice a lot of the things I'd learned from being a pediatric surgeon and taking care of children and families over 25 years and put that into practice.
Mm-hmm.
So then as I got into the role, I thought, well, you know what? I want to take some of these ideas and make sure that parents in particular, but people in general, knew the things that I'd learned over the years and wanted to empower parents with that knowledge so that they could get the best care for their children.
In Chapter 2 of your book, it's titled Old School. What does old school have to do when it comes to pediatric medicine?
Well, old school means to me, particularly in this context, the way doctors and patients that bond, that relationship that I've found so enjoyable as part of the practice, where there was that just tight connection. And with pediatrics and children, it was that tight connection with the parents and with the children, and the pediatrician would follow the families along, and they'd also be involved in all aspects of the child's care, and they were a resource that the parents could rely on, the children could rely on. I think what's happened over the years is that a lot of that has broken down through nobody's fault, but with technology, with hospitals, with insurance coverages. I think that bond with the primary care doctors is broken down a bit. What I was trying to do was through stories of just a great pediatrician, and as I was breaking into practice, build that sense of what it was like to have the connection between the pediatric specialist and the pediatrician, and the benefits to the patients. And it's almost a longing, because it was, I'm not sure that we can ever return to that, but I wanted people to look for those kinds of qualities in a practice, in a pediatrician, in a hospital, that emphasized the warmth and the experience and sort of the connection over time with the physician.
That's a very important aspect, that connection that you talk about between the patient and the parents and the doctor. Do you think that it's just as important for that connection to be established between the pediatrician and his environment, as that environment is, the hospital, the healthcare facility? Oftentimes, well, not oftentimes, I won't speak that generally, but sometimes you get that, as you say, that disconnect. I've got patient number 12 today at 4:00. We do things by the book, next patient. What about knowing intimately what is going on in that facility by the pediatrician, not just by the book, but knowing on a personal level what his staff is about, what the facility is about, what goes on? Is that just as important a connection as that connection between patient and physician?
Absolutely. And I think from the perspective of now being a hospital administrator, if you will, and leader, I think we have a responsibility on that side of things to be in a stronger connection with the pediatricians, with the referring doctors. And I think anything we can do to strengthen that bond, sometimes it's technology. So that's where technology can help. providing the laboratory or the X-ray but I think it's even more fundamental than that. I think it's really a mindset that we're all part of the same team. We're all focused on the same thing, which is that family and that child at the center of it. And so to treat each other as members of that team and really equal members of the team. I think the responsibility on the side of the primary care and the pediatrician is to, in a sense, advocate for their child to know who the specialists are, know about the emergency department, know what it's like in the hospital. I think it's amazing and so empowering when you see the pediatricians in the hospital. Maybe they're visiting a patient, maybe they're coming for a conference. And I think it's also a duty, if you will, for the hospital to make that easy. And I think, this is where telemedicine, other things can play a role, where we can make it easier because, people are busy. It's hard to get around places. But I think there's ways, if we think about it, we can get back to that quote unquote old school mentality of where we're all in it together.
You mentioned technology specifically as being a probable cause of this disconnect. Don't you think that the use of technology in order to make healthcare more efficient and have better patient outcomes, can't we use that same technology in order to reestablish that connection between the hospital and the pediatrician so that the hospital doesn't lose track of what pediatrician is going to? And on the other side of the coin, the pediatrician doesn't feel left out of the loop with what's going on in his or her facility.
That's it. That is just so spot on. I think what we don't want to do is just get so reliant on the technology that we lose the humanity, if you will. So I think what we want to do is find ways to use the technology to bring us closer together, not to divide us. And so if it's the electronic health record, yes, that's good, and it has so many benefits. But there's still something about that personal contact. Maybe it's a phone call, or maybe it's we use the telemedicine, so there's some face-to-face. And I think we're going to see lots more applications of that. And I think that's where it's a real responsibility on the one side for the hospital to make that available. And then on the other side, I think it's a responsibility of the primary care pediatricians and so forth to make that important and to advocate for that and use it in a way that helps their patients. So I think that, over the next few years, we're going to see more and more of that happening.
Your book, Healing Children, A Surgeon's Stories from the Frontiers of Pediatric Medicine. Where can our listeners go and get a copy of your book?
Well, I'm sure it's in the local independent bookstores. I'm sure it's also on Amazon. And, it's been doing great. And I've heard a lot of good feedback from parents and families because, in a way, through these stories of children, it's helped empower them to think about their own children and how they can get the best care for their kids.
We'd also like to learn some more about Children's National Health System as well. Is there a website for that?
There is a website, and that is childrensnational.org. And I have a Medium page, which is medium.com/@KurtNewmanMD.
Well, Dr. Newman, it's been a pleasure as always. I'm glad that you could return and talk with us. I'm hoping we can have some future conversations.
I'd love to be back.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. Subscribe to the podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at healthprofessionalradio.com.au and also at hpr.fm.